Hey, everybody, welcome to the T3 Fit Scoliosis podcast. I know it's been a hot minute, there's been a lot going on, but we're still here. And today we have a very special guest. His name is Rick Olderman, and he is the owner of Fixing Your Method. He is a sports orthopedic physical therapist, and he does a variety of things that he is here to share with us today. But he's also here to talk about his experience of being in this industry for 25 years and how it has helped people in the scoliosis world with his knowledge and his experience and what he's done along the way. So, Rick, I'd like to welcome you to the show.
Yeah, thanks for having me, Teresa.
Oh, absolutely. So, can you share with us? Break down for us specifically what is a sports orthopedic physical therapist?
Yeah, it's basically a physical therapist that usually deals with more acute, like sports or mechanical injuries, like motor vehicle accidents and things like that, strains, sprains, broken bones, things like that.
Okay.
However, I very quickly realized that the majority of my patient population were people with chronic pain,
Okay.
not these acute,
Mhm.
strains and sprains and things.
Okay. And when you're talking about the chronic pain, where specifically was that, if you wouldn't mind sharing that?
Head to toe,
Okay.
basically anything.
Okay. Okay.
So chronic just basically means anything over 3 months.
Oh,
So
okay.
yeah, so any unresolved pain for over 3 months is fairly technically a chronic issue.
Okay. Okay. And then our show is about scoliosis, and I know that you have also dealt with people with sciatica, and that can go on for years with some people. In your experience and in your profession, again, of 25 years, how has that related to back pain and then diving further into it with scoliosis? And how have you dealt with clients who have scoliosis along the way?
Yeah, so I have a unique way of looking at the body.
Hmm.
In medical school, we are trained to see things more from a component standpoint,
Okay.
meaning that our job is to identify which tissue is damaged, treat
Okay.
that tissue,
Hmm.
and then out you go. But this is why I believe we have chronic pain, is
Hmm.
because there's nothing that's testing why that tissue is damaged. And so that's what I felt was missing in PT school.
Hmm.
And, I've owned my own clinic for the last 10 years and trained a bunch of therapists there. They were all missing that piece too. It wasn't
Okay.
just me.
Okay.
We're not training the whys behind pain. We're only treating that something is happening. And we have a million
Okay.
orthopedic tests to figure out which tissue is damaged.
Yeah.
We have zero tests to say why that tissue is damaged. And so that's what I've been focusing on because as a, prior, I felt going into PT school, this was why we have pain, right?
Hmm.
Is
Hmm.
understand you, it's not your fault that I have back pain. It's my fault, right?
Okay.
So I have to be doing something causing this. And
Right.
so that's what was missing from my education. And
And
that's what I've been figuring out these last 25 years.
that's amazing because it is so much of the why. And in our world of scoliosis, the why is, if we had the answers to the why, it wouldn't be so emotional for us,
Hmm.
because the scoliosis, having scoliosis, I grew up with it, and in my world at the time, there was like nobody that had it.
Sure.
And now, there's it's evolving, and the whys of breaking it down are informing clients and giving clients education and empowerment.
I really hope to, you know, today I'd love to clue you in on my approach to looking at
Please.
scoliosis. It's very unique.
Absolutely.
And okay, so what I've done is I call my approach more of a systems method to
Okay.
solving pain,
Okay.
which is basically understanding the body as a system.
Hmm.
All right. So back pain and scoliosis kind of go hand in hand.
Hmm.
But what I've learned is that the back pain that people are having from scoliosis isn't often from scoliosis. It's from what scoliosis does to a different pattern in the back, and I'll explain that in just a sec.
Okay.
So, if your listeners have back pain, I'm going to take them through this little test so they can
Okay.
understand what I'm really talking about.
Okay.
So everyone just lie down on your backs with your legs straight. Lie down on the floor and just feel what your back feels like when your legs are flat on the floor like that.
Okay.
Okay. And now, and usually I'll have people stay like that for 20, 30 seconds, but
Mhm.
we'll kind of speed things up here for this
Mhm.
podcast. So what I'd like you to do now is bend your knees so your feet are flat on the floor,
Mhm.
or hug your knees to your chest.
Mhm.
All right. So Teresa, do you have back pain yourself?
No.
Okay. So can you imagine which position might feel better for our back and of these two positions?
Yeah,
Which one?
I would say with the knees bent and a
Correct.
neutral spine.
Absolutely. So
Mhm.
99% of the people listening will feel, well, since this is a scoliosis podcast, perhaps 100%
Okay.
will feel better. Their backs will feel better when their knees are bent. So what's going on here? Well, the obvious answer is that when the legs are straight, you can feel that your back arches off the floor a little bit more than when
Right.
your knees are bent and your back is flatter to the
Mhm.
floor. So you might think, oh, well, the shape of my spine is wrong. No, what we're doing is when your legs are straight, there are connections from your legs pulling on your pelvis that cause your back to become more arched.
Mhm.
When you bend your knees, you're removing those forces from your pelvis, and your
Mhm.
pelvis is returning to its more natural position,
Mhm.
which then restores the back to its more natural position. That's why it feels better.
Okay.
All right. Okay. So we've just learned that your back feels worse when your legs are straight and your back is more arched, and it feels better when your knees are bent and your
Mhm.
back is less arched.
Mhm.
So now everyone stand up and listen to this podcast for the next 10 minutes or so. And what I want you to do is I want you to notice after about a minute or so, what you're going to notice is that your knees will start locking straight or backwards. Okay.
Okay.
And so let's go ahead, even if that's not happening to you, go ahead and do that right now and feel that your knees are locked backwards. And now feel what your back is doing. And now unlock your knees and feel what your back just did. And if you're not sure, go ahead and lock the knees one more time, and you will feel that when your knees are locked, your back arches more. And when your knees soften, your back arches less.
Mhm.
Pretty much just like we just discovered on the floor.
Okay.
But we don't take that information from the floor and apply it to an upright position.
Okay.
So this one tip alone solves a lot of back pain in people, is getting them to start unlocking their knees when they're standing, walking, and so forth.
Mhm.
So what that's doing is taking that arch stress from the spine because we're relaxing some of the key leg muscles that are pulling on that pelvis by softening the knees. So locking the knees is an energy conservation move. We do it as we get more fatigued, and especially females who have had children will
Mhm.
often do this more because as their fetus is growing in their belly, it becomes heavier and heavier, and they lock their knees more and more so they don't have to use their leg muscles to hold themselves up.
Okay.
Then after the baby's born, they continue with that pattern, and so they've kind of established this pattern of knee locking to
Mhm.
stand and walk. So anyway, that's what I mean by a systems approach is that we have to understand the habits that you're doing that involve the whole system and how that affects a particular area of pain, in this
Okay.
case, back pain.
Okay.
So that tip alone will help a lot of people with back pain. If you have back pain, just unlock your knees.
Okay.
All right. And that will help a lot. So do you have any questions about that? Because I was
I
going to go
I
into the next
I
pattern.
do. So if somebody wants to try this and they're not comfortable lying down, would you suggest that they do it lying against a wall? Or should they just do
Well,
it in an upright position as well, standing
Well,
up?
I'll tell you what, you don't even have to lie down. I mean, you don't have back pain and you knew that your back would feel better with your knees
Yeah.
bent.
Yeah.
So if you already know the answer, you don't even
Okay.
have to do the test.
Okay.
The test is
Okay.
for those people who really have no idea. And you can lie down on a bed or a couch or whatever.
Okay.
You'll still feel the same change in
Okay.
your back
Okay. And
shape and pain.
one more question. So sometimes with people with scoliosis, there's a prominence, right? Otherwise known as a rib hump.
Hmm.
So if they're lying down on the floor, is the comfort level in their pelvis and their spine going to be different in one side in your experience versus the other side?
It
And is
may,
there
and
any
go ahead.
sorry, I was gonna say, and what would you suggest that they do for that?
Well, that's where the second pattern comes in.
Okay.
All right, so we're just about to so I'll show it. I've got a little skeleton here,
Okay.
folks. So scoliosis in medical terms is basically a lateral curve of the spine.
Mhm.
It doesn't talk about why that curve is occurring. It could be a congenital or structural curve,
Mhm.
or it could be a functional curve. All right. So many people, most people who aren't born with scoliosis develop scoliosis because of functional reasons. And those people born with scoliosis, that scoliotic pattern tends to deepen because of functional reasons.
Mhm.
So function has a lot to do with the speed that scoliosis is forming and whether it forms at all.
Okay.
And it turns out solving it too. So the second pattern of things that are happening in the body around scoliosis is that there's something. Some people have a one side of their pelvis that's higher than the other, and that same side of rib cage is lower.
Mhm.
Okay, so if you're looking at this picture, I call this a side bending pattern,
Mhm.
where let's say the right pelvis is higher and the right rib cage is lower.
Mhm.
Okay, this is more of a functional pattern that's occurring.
Okay.
And so this would be defined as a scoliotic curve
Mhm.
in the low
Right.
spine. Now, this side bending pattern typically occurs because of something in the right leg. Some problem there
Mhm.
is occurring, and the brain is tapping into a reflex that we're born with called the withdrawal reflex
Okay.
to get us off of the painful whatever it is in that leg.
Mhm.
And it does that. It's called a withdrawal reflex because it pulls the pelvis up off of that thing. You can watch YouTube videos of this with little babies. When
Okay.
they touch their feet down on something,
Mhm.
they immediately withdraw it. But it's not just the knee that's bending, it's the whole waist area that's shortening to
Mhm.
withdraw that leg.
Okay.
And so the muscles that are pulling the pelvis up are also attached to the rib cage. So they are going to pull the rib cage down,
Mhm.
which, as you can imagine, creates compression on this side of the spine,
Okay.
which contributes to sciatic pain, SI
Right.
joint pain, unilateral back pain.
Mhm.
Okay, so that is the functional scoliosis. All
Okay.
right. But the congenital or structural scoliosis has, let's say, the same right pelvis is up, but this time the left rib cage will be down. And
Okay.
that's because of this kind of more S curve that's occurring.
Mhm.
This is the pattern that you see with the rib hump that you were talking about
Right.
just a second
Okay.
ago.
Mhm.
Okay. So, but these structural scoliotic curves can also be corrected by functional means. Because
Okay.
what happens is, as that curve happens, we develop weaknesses and patterns of walking that
Mhm.
feed into the formation of that scoliotic curve.
Mhm.
Those can be corrected. I mean, I correct functional or both types of scoliosis
Okay.
frequently. It's not
Okay.
that hard to do. And so this is the interesting thing about scoliosis, though. When you have an S curve scoliosis or a structural scoliosis, where the one side of the pelvis is higher and the opposite rib cage is lower, I have found that what that is doing is locking the low back into this arched pattern.
Mhm.
So that first test that we did on the floor with the knee straight
Mhm.
versus bent, if you have structural scoliosis, you have an almost 100% chance of your back hurting more with your legs straight, because the S curve is also locking the back into this arch position.
Mhm.
That's what's causing pain. And so if we can get rid of that arch force,
Mhm.
regardless of whether we've changed the scoliosis, your back pain will go away.
Okay.
All right. So then what we can talk, this gets into your other question. Well, when we're lying on our back and we have a rib hump and we have some kind of twisting of the body, what's
Right.
going on there, right? Well, this is the interesting thing about scoliosis is that often we have these big thigh muscles, all
Mhm.
right? And they start at the knee and they attach right here at the front of the pelvis.
Mhm.
They are massive. I mean, think of your quads,
Yeah.
they're just huge, right? So when these muscles become tight, they tend to pull the pelvis forward, causing an arching force in the low
Mhm.
back in
Mhm.
response. All right. Now, this is often, especially in scoliosis, this is an asymmetrical pull.
Mhm.
So we have one side of the pelvis that's tighter than the other, causing a rotation in the pelvis
Mhm.
and torque across the SI joint that then is compromised by the S curve of the spine.
Okay.
Often these forces can be relieved just by stretching the thigh muscles correctly at the pelvis, which then restores the forces acting on the pelvis,
Okay.
which then relieves the arching force from the low spine. And because it's an asymmetrical pull, for instance, one side of the pelvis will be pulled down more than the other. That then creates a natural functional side bending problem in the body,
Mm-hmm.
or the first type of scoliosis that we just talked about.
Okay. Okay.
So the asymmetry of this thigh tightness can contribute to and even cause scoliotic changes in the spine.
So how would you help somebody who is dealing with this?
Yeah.
How do you help them to relieve if they have pain with scoliosis, or if they have scoliosis and they don't have pain? Because I didn't have pain growing up.
So if you want to correct just the scoliosis,
Mhm.
this is often fed by a gait pattern. What is happening is when we're walking, subtly what is happening is when we step on one leg,
Mhm.
there's a weakness in the pelvic muscles here that
Mhm.
is causing us to subtly drop that rib cage down,
Okay.
or the hip juts out more on that side.
Okay.
All right. So simply, if we become aware of that and correct that, that will stop the scoliotic forces from acting and causing the scoliotic
So
forces or the shape.
how do you correct it?
Oh, it's well, first of all, you have to decide, which side is weaker and where all this is
Right.
occurring.
Right.
But I have a really simple exercise. Well, there's two that I would recommend.
Okay.
One I call the butt pump. All right. Because often, if there's an issue of this happening,
Mhm.
what is happening is one of the muscles, the gluteus maximus, the big
Mhm.
butt muscle,
Mhm.
isn't working well.
Mhm.
And what that does then is the gluteus maximus is responsible for causing this thigh bone in the hip socket
Mhm.
to track correctly in the socket.
Mhm.
And so when it's not working, this starts to get really sloppy and it breaks down the hip joint, causing arthritis, labral tears, all sorts of
Okay.
bursitis, all sorts of problems. Okay,
Okay.
so that's one of them. So one of them is like you just get on your elbows and knees and you do a donkey kick kind of
Okay.
thing,
Mhm.
right? So that's the butt pump. Now the second one, which is particularly important for scoliosis, is it's a standing hip strengthening exercise that I do.
Mhm.
So what
Okay.
you do is you stand in front of a mirror,
Mhm.
and let's say you're standing as level as you can,
Mhm.
and you lift up one leg just a half inch.
Mhm.
Notice how far your body is shifting over and whether
Right.
your shoulders drop on that stance leg.
Mhm.
And then do it on the other side. And I'll bet you that if you look closely, you're going to see an asymmetry in how you stand on one leg versus the other.
Okay.
So, what you would do typically, uh, well, since I don't have a body to work with, what I would say is the pick the side that doesn't hurt, or
Okay.
the side that seems taller and better
Mhm.
as your good side. And
Mhm.
so that stance leg, look at how you're standing on that leg.
Mhm.
That's what you want the other side to do. So
Okay.
then what can do is just slowly shift to the other side and try to reproduce what you just did on the good side.
Okay.
Okay. Now, often, because what is happening is the weak muscles are weak, this same shoulder will drop down.
Right.
So, a simple thing I have people do, just put whatever bad side it is,
Mhm.
put that hand on your head. For instance,
Okay.
your right hand on your right head, shift your weight over to your right leg.
Mhm.
And what that's doing is it's pulling up the rib cage and preventing it from coming down towards the pelvis,
Okay.
which then forces the hip muscles to stabilize that area better,
Okay.
because the rib cage dropping down has become often a learned behavior
Right.
because of this weakness.
Mhm.
And so you can't break that habit without forcing it to be corrected with
Okay.
simply just putting a hand on your head.
Okay. Yeah, because I come from, prior to my surgery, I was a dancer. So in
Hmm.
the ballet world, it was stand tall, and it was like
Yes.
make believe that somebody's pulling your hair from the top of your head so that it
Yes.
keeps you to stand upright. So even when I work
Right.
with my clients, if we're doing marching, it's stand tall, don't let your weight shift into one side,
Yes.
but stand
Well,
tall, holding something, like
now,
if we're doing kettlebell goblets, but
yes.
stand tall doing it. And it's really hard.
Yes, it is. So that and you can use those kettlebells to offset these curves
Right.
as well.
Right.
But what I would do is, rather than letting them stand tall with both feet, I would have them start doing the weight shifting and learn how to correct that, whatever side is asymmetrical or
Mhm.
painful, You
Okay.
have them learn how to correct it, like just by weight shifting from one side to the other.
Yeah.
It's a hugely powerful and effective way of correcting
Okay.
functional scoliotic patterns.
Okay. And we talked a little bit about sciatica. So the connection of
Yeah.
sciatica with scoliosis, can you share that with us too?
Oh, sure. Yeah. So, I mean, if you have a functional scoliosis,
Mhm.
where what I call a side bending problem, where you have say the right pelvis up and the right rib cage down,
Mhm.
well, it's pretty. I mean, almost always, if you have a right side bending problem, you're going to have right sided sciatica
Okay.
because you have right sided compression on the nerve roots of that spine,
Mhm.
right? And so sciatica isn't only due, though, to the shape of the spine. Remember what we talked about just now is that the tightness in the thigh muscles pulling on the pelvis,
Mhm.
that will also contribute to the scoliotic curve.
Okay.
So if you're not also stretching muscles like that to restore balance to the pelvis,
Mhm.
then this pattern will keep returning again and again and again. All right. So in an S curve, well, I find it's a 50-50. So it's either going to be on the side where the pelvis is higher, or it's going to be
Right.
on the side where the rib cage is lower. It just
Okay.
depends on other factors that are going on in that person
Okay.
and what's contributing to that scoliotic pattern.
Okay.
But almost, I would say though, if you have an S curve and you have sciatic pain, you've probably got some problem in that leg, an old injury of some sort
Mhm.
in the sciatic leg that needs to be addressed, because the sciatic pain is occurring because of some weakness or unusual tightness, like these thigh muscles that we described earlier.
Okay. And so how would is there something that you can suggest for people like if somebody says, "Oh, I think I might have that going on." What is
Yeah,
something that how what's the educational tip that you can give them so that they can kind of assess their own bodies like you did with
yeah,
standing on one leg, so that you're
sure.
shifting the weight?
Well, here's an easy one for people. First is just take your shirt off and have someone take a picture of the back of you.
Mhm.
If you have had a side bending problem for a while, or S curve scoliotic pattern for a while, you'll notice that there's one side of the spine back that has a bigger crease in the waist than the other side.
Okay.
The side with the bigger crease is the side with the more compression.
Okay.
All right. And if that happens to be the side where your pain is, then that's the side where you should focus on starting to pay more closer attention to weaknesses on one side versus the other.
Okay.
Okay. So to take this a little bit further, if we were, for instance, that hip strengthening exercise,
Mhm.
right? So rather than just lifting one foot off and then the other, so let's say that's really easy, and now you see, oh yeah, it's my left side, it's weaker, and I can correct that if I really pay attention. Well, now we need to add resistance to it to make it strong out in the world.
Right.
So what I have people do is I have them get a exercise tube, stand on it with both feet, and then do the same thing. And the foot that's up, now you're pumping it out to the side like this,
Okay.
just about 6 inches.
Okay.
And what that does, it's not strengthening the leg that's moving. It's strengthening this leg that's down, because it has to stabilize
Right.
against this movement, against resistance.
Yeah.
And so what you'll find is that as it tries to stabilize, this rib cage will start to sink down more and more and more, because you don't have the strength to do that. Or you'll see that the hip juts out to the side more and more and more like that,
Mhm. Mhm.
because of the lack of strength.
Okay.
That's what you have to pay attention to a little bit more closely, because you can solve that's just a strength issue. You can
Yeah.
solve that. And that will have huge benefits to the formation and feeding of the scoliotic curves that are occurring in the body.
Yeah, that's interesting, and I mean, we're doing this over Zoom, and you're showing me a skeleton, and I'm a very visual person, so seeing that, it makes total sense, right? Because that's also what the body is then conditioned and comfortable to doing with a curve and just leaning into that curve.
Correct.
So to try to counteract that, to stand in a different position, makes
Yeah.
sense to strengthen the stabilizing leg on that.
Yeah. And I'm sure you've looked into or heard of the Schroth method.
I did it with my
Yeah.
daughter for 2 years.
Okay. So I haven't studied the Schroth method.
Okay.
However, they seem to be very effective for correcting scoliotic curves.
Yeah.
And I think that they are doing something similar to this with their strengthening exercises, is to force that to stabilize on that side in
Yeah.
some way. Oh, I was going to say a lot of people with scoliosis also have neck pain and headaches.
Mhm.
And I would like to talk about the connection between scoliotic changes and neck pain and headaches, because
Please.
this is even more dramatic, I think, than what we just talked about
Okay.
and misunderstood. So if you look at the body, most of it, and right now I'm holding up the skeleton, and
Mhm.
you can see most of our body is made up of these long bones,
Mhm.
right? Long, thin bones. But there's two areas on the body that are made up of different bones. One is the pelvis, and this has a broad, flat bone. And we all
Mhm.
know that the pelvis is the center of function for the lower body system
Mhm.
and the back system.
Mhm.
The second area are the shoulder blades. Same as the pelvis architecture, they are also the center of function for our upper body system.
Mhm.
Okay. Most people with neck pain and headaches have been treated by practitioners who are looking at the neck or the head as the source of the problem, right?
Okay.
And that's why they have chronic pain. It's because that's not where it's coming from.
Mhm.
The cause of most chronic neck pain and headaches is the shoulder girdle system, because there are significant attachments from the shoulder blade, and you can look them up on Google if you want, from the shoulder blade to the neck and the head. And so when you solve the shoulder girdle system, you solve neck pain and headaches. And I've got a new book coming out next year, Solving the Pain Puzzle.
Okay.
And I think I have a story on my website, rickolderman.com. One of the stories from the book involves neck pain. So if you want to
Okay.
read about that, you can go to the website and read that for free. All right. So you brought up this point. So if we just take that as a given, and I can go deeper into those connections if you want to, but if we just take this as a given that I'm telling the truth, that the shoulder girdle system is the cause of most chronic neck pain and headaches.
Mhm.
You brought up a point earlier, Teresa, about the rib pump.
Right.
All right. And we've also been talking about the rib cage
Mhm.
position. And then
Mhm.
often in scoliosis, whether it's functional or structural, there's a depression in this rib cage towards the pelvis.
Mhm.
All right. So if we know that the shoulder blade is resting on the rib cage, and we know that the rib cage is depressed because of a scoliotic issue,
Mhm.
then the shoulder blade is also depressed, which
Okay.
then changes the tension pattern from the shoulder blade into the neck and head. Does that make
Okay.
sense?
Yeah.
So fixing the rib cage by what we were just talking about
Mhm.
can also help fix neck pain and headaches, because
Okay.
it's going to restore proper alignment of the rib cage on which the shoulder blade rests.
Okay.
And then those muscles attaching from there to the neck and head can also receive a lot of relief from the strain that they're under because of the scoliotic curve.
Okay.
But now you also mentioned that there's a rib hump, all right, and this is common with structural scoliosis.
Mhm.
Is that a so there are rules about how the shoulder blade should be resting and moving, and the whole purpose of this is that when we are raising our arm up in the air, right, this shoulder blade should be assisting, pushing that arm up in the air to
Mhm.
support that whole system. And so, but what happens is when there's a rib hump back here, that shoulder blade gets stuck a little bit. And
Okay.
what happens is what I have found is that people with with a scoliotic rib hump, they either allow the rib cage, the shoulder blade to be on the outside of the rib hump towards the front or the side of the body,
Mhm.
or they create excessive force trying to pull the shoulder blade in toward the spine to get over that rib hump and hold it there. So the shoulder blade is either too close to the spine or too far away from the spine,
Okay.
depending on how they've decided subconsciously to
Mhm.
deal with this rib hump.
Okay.
Usually they pull it in too close,
Uh-huh.
because if it's too far out away, then they feel like their whole arm is almost out of the socket. It's just
Mhm.
resting
Mhm.
forward. It feels like it's poor posture and all that kind of stuff. So there are unique issues that occur because they've developed this holding pattern around this rib hump of holding the shoulder blade here. One of them being that when the arm is raising up, they don't know how to let it go now, because they've trained it to be towards the spine. It
Mhm.
can't move anymore. And so what
Okay.
that does is it causes the shoulder joint itself, all the little muscles here, to overwork and become
Okay.
impinged.
Okay.
And so there develops a lot of shoulder problems.
Okay.
Does that make sense? in a nutshell?
Yeah, to me that makes sense. To me that makes
Okay.
sense. But then how do you release that?
Yeah. So first of all, we have to show them that this is what's happening.
Mhm.
Okay. And so that they can wrap their mind around,
Right.
oh, I have been holding that back there. Or, oh, that's why it's hard for me to do this or that or the other, right?
Right.
We're not going to change that rib hump. At least I don't have any studies that show that it's going to change from what I'm doing anyway.
Okay.
So maybe I am changing it, but
Okay.
I'm just a
Okay.
clinician. I don't do research, right? So anyway, so first of all, we teach them that this is happening,
Mhm.
and then what we do is I get in there with my hands and I loosen the shoulder blade from the rib cage.
Okay.
That allows it now, because it's become so adhered down,
Mhm.
it just can't move.
Okay.
We've got to loosen that up so it can move. And
Okay.
then I give them like a child's pose stretch,
Okay.
right? Where they
Mhm.
lean back. And what
Right.
that does is it starts to get the shoulder blade moving the way it's designed to move for them.
Okay.
It's simple. So one of the other things though is that, let's assume that the rib cage is depressed and therefore the shoulder blade is depressed and
Mhm.
therefore these connections to the neck are wrong.
Mhm.
What I can also do is I tape up the shoulder blade into a better position
Okay.
to put it back into a better position and keep
Okay.
it there. And it's almost instantaneous relief for most
Okay.
people with neck pain or headaches.
Okay. Okay. And
All of
and
these things, by the way, are in my home programs.
okay.
The taping techniques, everything.
I was just so you just talk about taping, and I did this. I
Mhm.
didn't. I watched the therapist do it with the Schroth specialist do it with my daughter. Can you dive into that and what it does?
Sure. So, well, in the case of a shoulder girdle system taping, uh, one of the rules of the shoulder blade is that when the arms are resting, this spine of the shoulder blade should be resting at thoracic level two.
Mhm.
Almost always with people with chronic neck pain and headaches, it's going to be resting at thoracic level three or four. All
Okay.
right. And the person doesn't have the means on from which to change that at all, because there are lots of reasons this is happening,
Mhm.
regardless of whether you have scoliosis or not.
Okay.
So what I developed was a technique where I tape the shoulder blade
Mhm.
and then lift it and then put the tape over, so it's holding the shoulder blade up, and that is then unloading the connections between the shoulder blade and the neck bones and the base of the skull.
Okay.
Does that make sense?
That makes sense.
It's hugely powerful for getting instant pain relief for any kind of chronic neck pain or headaches.
Mhm.
The only caveat to that is that, well, there's two. One is that the tape that I use is, some people with, especially with fair skin, have
Mhm.
an allergic reaction to it,
Yeah.
because you can imagine a shoulder girdle system weighs about 20 pounds.
Okay.
The tape has to be quite strong to be able to hold that up,
Yeah.
right? And part of the reason that is strong is because of the nature of the adhesive in the tape,
Mhm. Mhm.
which then causes the skin to break down. But usually, the first time I tape people, I tape them for like 4 hours. That's
Okay.
usually long enough for us to know whether this is the right thing to do or not.
Okay.
And I would
Okay.
say 99.9% of the time it is.
Okay.
And then we use the tape as a bridge to get them feeling better. That convinces them, oh, it is my shoulder blade. So we fix that, and then they
Mhm.
wean themselves off the tape
Okay.
after that.
So the taping creates tension in the shoulder blade to bring it to a proper alignment and then takes the
No,
tension. No. Okay.
it's actually relieving tension in the shoulder blade.
Okay.
You would think by making it go up higher that it
Mhm.
would be causing tension, but actually, there's a what the primary muscle that's causing pain, neck
Mhm.
pain, and headaches is the levator scapula. It
Okay.
comes from the corner here. It goes up to the C1 through 4.
Okay.
All right, and levator means elevate, right?
Mhm.
So it's under stress because it's trying to lift the system up,
Mhm.
right? But the system weighs 20 pounds, and it's just a little pinky muscle, right?
Okay.
The
Right.
big muscles aren't doing their job, or they're pulling the system down,
Okay.
or the rib cage is depressed in the case of scoliosis.
Okay.
So it's left up to this little teeny tiny pinky muscle
Mhm.
to do all this work. Well,
Mhm.
what we're doing is by lifting the shoulder blade up, we're reproducing the levator scapula. It finally gets this someone to come in and say, "Hey, take a break. I'll hold this for you."
Okay.
And so it's relieving tension in
Okay.
the shoulder girdle rather than causing tension.
Got it. Okay. Okay. That makes sense. Just
Yeah,
I
it
was just
works.
it just when I hear about the tape and then bringing it, my mind goes to, okay, it's going to create tension, but it doesn't do
Of
that at all.
course.
So,
Yeah. There's tension on the tape,
right.
uh,
Right.
but not in your system. I'd
Yeah.
rather be in the tape rather than in your system.
Yeah, because I remember doing my daughter had to have it when she started the Schroth and then they taped her and then she would have to keep the tape on. And for the most part it stayed and she was on the swim team and sometimes it stayed and sometimes it didn't and
Yes.
then they would have to retape her. Um, and it worked quite well. I remember I remember those 2 years quite well.
Now, Teresa, you've mentioned emotional issues a couple times since we've
Mhm,
talked.
mhm.
I would like to speak a little bit about that too, if you don't mind.
Please, by all means.
Okay. Okay. So, um, uh, it's a big thing to unpack, but I'll try and make it as short as possible.
Okay.
So, we have um, patterns of fascia that run through our bodies.
Right.
All right, and there are superhighways of these fascias of fascia that connects the bottom of our feet to the top of our head.
Mhm.
Okay, so there are different types of fascia that occur in the body, and one of those types is called myofibroblasts. And myo means muscle. It has 4 times the contractile capacity of regular muscle, of
Okay.
regular fascia, and that's typically laid down in areas of mechanical stress. Well, with someone with scoliosis, they've got their fair share of areas of mechanical stress
Yeah.
because of the pelvis misalignment, the rib cage, the rotation, the rib
Mhm.
hump, all sorts, and then all the compensations that are occurring because of it, right? So they may have a higher concentration of myofibroblasts than most other people.
Mhm.
And so there's there's something called transforming growth factor beta 1, which is a cytokine that's released from our immune system
Okay.
under when we're under stress, whether
Okay.
that's emotional stress, work stress, or whatever. Well, those trigger the myofibroblasts to contract more.
Okay.
So if those myofibroblasts are laid down in areas of mechanical stress and they're prone to contraction during times of stress because of the release of the cytokine,
Mhm.
this is why under uh, when we're under emotional or psychological stress or trauma, or we have some unconscious trauma in our past that
Mhm.
we're not really dealing with,
Mhm.
that has set up shop in our body.
Mhm.
This is one of the ways I believe. I can't prove it, but the pathway seems to be this: um, that this is how trauma or emotional stress is being lodged in our body in
Okay.
certain different areas,
Okay.
and it leads to my overall theory of chronic pain in that we all have a threshold above which we have pain.
Mhm.
And whether your threshold is up here or down there, it doesn't really
Right.
matter.
Right.
Above it, you have pain. And I believe that there are 3 things that are pushing us to that threshold. One are musculoskeletal issues, that what we've been talking about.
Mhm.
Another are dietary and allergens and mold, things that we ingest
Mhm.
that cause an inflammatory response in our body
Okay.
that also trigger that pain.
Mhm.
The other is the emotional, spiritual, psychological trauma
Right.
that also triggers tension patterns in our body.
Yeah.
And so you can have all 3 of these, you can have one of them,
Mhm.
everyone's different.
Yeah.
But this is my 3 pillars of pain theory. This is why you can read books that like John Sarno's, where, hey, I read this book and my pain went away, right?
Mhm.
Well, that's because your pain was primarily an emotional issue.
Mhm.
This is why it wasn't solved mechanically in the first place. It's because it wasn't a mechanical issue.
Yeah.
And other people you'll read, oh, I had this diet and my arthritis went away. Well, that was because you had a dietary or a mold, you know,
Mhm.
irritant in your system.
Mhm.
So it can be a combination of all. And this is why I believe there's no one person who has all the answers to everything.
Yeah.
It's because we're such a multifaceted organism.
Yeah. But that's why we have this podcast and that's why you're on it and sharing all of your knowledge about it. And I know that you are in Colorado,
Mhm.
and I'm in New York, and I thought you were somewhere else. I thought you were in California. But
That's
if
okay.
people
you thought I was someone else too. So,
I
you know,
did, I did. I said, "You have a very familiar face," and then one day I'll see that other face and I'll be like, "That's who I thought he was," but it wasn't.
well, if it's George Clooney, then I'll feel really good about
It
that.
w it wasn't him.
Oh,
I'm sorry.
that's
But
okay.
Rick, please share with us if somebody has questions and they want more. I know that you have, DVDs, I believe, on your website?
There are downloadable home programs, so you can
Okay,
access them, online, or you can get the DVD, or you can get both if you want. But
okay.
the way this has worked out is, I've spent the last 25 years figuring out all of these things and
Mhm,
how it creates pain in the body.
mhm.
And then and so I wrote a series of books about 10 or 12 years ago,
Okay.
and they've sold well, and they've helped a lot of people.
Mhm.
But it wasn't until I owned my clinic that I understood that these things are happening in patterns of problems in people.
Okay.
And the same pattern might cause back pain in me, but might cause sciatic pain in you, or
Right.
SI joint pain in another person.
Mhm.
It's the same pattern. It's your personal history that has made it manifest as a different type of pain,
Okay.
but it's the same thing. So, anyway, after I recognized this, I created these home programs to help people more quickly and succinctly solve their pain.
Okay.
And so there you can find those at rickolderman.com as well, or
Okay.
fixingyou method.com.
Okay.
Uh, at rickolderman.com, it has, my patient stories from my upcoming book, these
Mhm.
home programs, and I also have created an online training program for health and wellness practitioners
Okay.
to solve pain based on a systems approach,
Okay.
which is much different than what we've been trained to do. And it's very effective.
Okay.
And if you buy anything from me, if you type in "fixing you," all one word, you'll get
Okay.
a 20% discount.
Well, anybody who has any questions, Rick has provided you with all the information. And please feel free to reach out to him at any time. If you're in Colorado, if you're in New York, where I am, he's
Anywhere
approachable.
around the world.
Rick, I would like to thank you for being a guest and sharing your knowledge about scoliosis and the methods that you have created along the way to help people like myself and people in my community. And thank you for being a guest on the show.
My pleasure. Thank you for having me.